Hi, my name is Alice Charitable, and I am an RN in the Clinical Decisions Unit. What that is a 23-hour observation unit that is part of the emergency department. In my profession, I have many roles, but one of the greatest roles that I have as a nurse is being an advocate for my patients. Luck says that as frontline healthcare providers, we have a unique role as advocates within our workplace and our communities in creating a positive environmental change through the changing of healthcare policies and practices. Today, I will be discussing how nurses can promote the elimination of tobacco exposure. This topic is important because tobacco exposure causes numerous health effects on the body for those who choose to smoke and as well as for those who don't. A population that is greatly affected by tobacco exposure is children who haven't yet reached a maturity level to choose. Therefore, I'm addressing the parents of children who are ages 0 to 12 on why tobacco exposure should be eliminated. According to the Pediatric Clinics of North America, asthma is the most common chronic disease among children, affecting more than 6.8 million children in the United States. That's 9.3% of all children. So that is a very impressive statistic for how many children are affected by these respiratory conditions that may be related to the exposure of tobacco. A study by Plus One found that environmental tobacco exposure during the postnatal period and during both pre and postnatal periods were associated with behavioral problems in school-age children, such as abnormal emotional symptoms and internalizing problems. Environmental tobacco exposure was considered the active smoking of mother, father, or anyone else in the household, according to the study. And that's just really important for us to know because kids are such at a crucial stage, and the developmental stage is so important in a child's life, and it can play a great role in the child's susceptibility to having these respiratory conditions and many other diseases later on in life. Asthma is also a ve- Asthma is also a public health problem for the community. According to the Pediatric Clinics of North America, asthma costs the healthcare system $56 billion annually, with direct healthcare costs estimated at $50.1 billion and indirect costs or lost productivity contributing an additional $5.9 billion. The article also suggests that 8% of children 8% of asthma in children ages 4 to 6 years of age could be attributed to environmental tobacco exposure in the home. These are some pretty impressive statistics, and they show just what a great impact that asthma has on our community. An article from the Current Opinion in Allergy and Clinical Immunology states that secondhand smoke exposure impairs histone deactylase 2 function, which possibly contributes to the resistance of steroids in children with asthma. The author also suggests that smoking not only aggravates respiratory conditions, but may make these conditions uncontrolled and more difficult to treat in the future, thereby decreasing the quality of life of these children because they are living with these conditions that are difficult to manage. So they're having repeat admissions for asthma exacerbation and in and out of the hospital, which is not a life that a kid wants to live, living in and out of the hospital. So some things that people in the community and people who want to learn how to reduce tobacco exposure, what they can do is some of these things that I'm about to name here, okay? Parents who have children ages 0 to 12 or who have children, period, they need to be mindful of the young lungs around them. And they can do this by limiting the amount of tobacco exposure to their children by choosing not to smoke in the house. Maybe possibly they can smoke outside or in the backyard, or maybe if they have a patio or deck, they can go to those areas and leaving the inside areas as smoke-free, which won't completely eliminate the children's risk to secondhand smoke. However, it would at least eliminate some of their tobacco exposure, and that could have some great benefits as well. Also, some apartment complexes have made some strides in places such as Boston, according to Plus One, and they have suggested that smoking, they have prohibited smoking in Boston Housing Authority-owned apartments in 2012 in order to protect residents against tobacco smoke exposure. And although it's difficult to regulate tobacco exposure in the home, one action that they could also do to reduce tobacco exposure in children is for people, whether it is nurses, healthcare providers, parents, they need to support and lobby for the smoke-free legislation in public places. I know that many healthcare professionals, specifically nurses, little bit hesitant to becoming too involved in policy, healthcare policy. They kind of they kind of see it as something that happens to them rather than something that they have an active hand in. However, we do have a voice and we do have a say in a lot of these legislations, and our representatives do listen to us, but we have to make that effort as well. According to the European Respiratory Journal, many European countries have made strides in reducing respiratory tract infection-related hospital admissions during the first 6 months following smoke-free legislation. Also, many hospitals have transitioned to becoming smoke-free facilities to promote the health of patients, the community, and the environment. My hospital recently transitioned to becoming smoke-free in July of last year, which has been a difficult process. It has been really important to increase awareness about the dangers of smoking and to support these policies that stimulate healing. As healthcare professionals, it is important to encourage women not to smoke because of the birth defects associated with smoking during pregnancy. Women smokers are more likely to quit when they are pregnant. And, because they're in this vulnerable state and they want to do whatever is best for the baby. And also, while patients are in the hospital at all in general, whether it is male or female, it is a great opportunity for nurses to educate patients about the effects of smoking and to give resources to patients on how to quit. So there are just some few obtainable goals that I believe that can be reached in order to reduce tobacco exposure in the community. And one of those goals is to implement smoke-free legislation for public places. This is currently an approach of the World Health Organization, according to the European Respiratory Journal. Currently, less than 50% of the world's population has smoke-free legislation. We'd like to increase that to 50% of the world's population to have smoke-free legislation, and then in following years to completely to raise that number, and then hopefully, in essence, have smoke-free legislation 100% of the world's population. Another goal would also be to reduce the amount of women who smoke during pregnancy. The Annals of Agricultural and Environmental Medicine say that 14.7% of mothers smoked during their pregnancy, which is a factor associated with childhood asthma. And so our goal would be to reduce this number to less than 10%. And this would not only decrease birth defects that are related to smoking during pregnancy, but it would also decrease secondhand smoke exposure during infancy, while they're at such a crucial developmental stage. And lastly, our goal would to have an overall reduction in respiratory condition-related hospital admissions in children by reducing environmental tobacco exposure through the promotion of smoke-free legislation. So in conclusion, I believe that all these goals are attainable and would work to reduce smoking-related respiratory conditions in children's ages 0 to 12. As healthcare professionals, it is important to advocate for our patients, and it's even of greater importance to advocate for those patients who cannot advocate for themselves. Studies show that it is evident that smoking is linked to having these health conditions in children. The nurses must have an understanding on how the environment affects the healthcare outcomes and must take initiative on manipulating environmental settings in order to promote healing. It's the responsibility of nurses to promote the health of people by contributing and creating a positive environment that is optimal for healing. This is my presentation, and I hope you all enjoyed it. Thank you for your time.